Hello and welcome. This is Laura Leone, and I am here to talk to you today about an innovative approach to reducing and hopefully eliminating adolescent suicide. So imagine yourself sitting in this medium-sized baseball field, and now look around you and consider that every single one of these people has died by suicide. Last year, over 44,000 people died by suicide, which is roughly the number that this particular baseball stadium could hold. When we think about the 12 grand challenges for social work, one of them is ensuring a healthy development for all youth. But we are not ensuring a healthy development for our youth if they are dying prematurely by suicide. Suicide is the third leading cause of death in adolescence, and for females aged 15 to 19, it's the first cause of death. We also know that people who die by suicide, about 50% of people who died by suicide saw their primary care provider within 30 days of their death. And this really speaks to an opportunity that we have to really change the practices within primary care so that we are reaching and intervening before those people die by suicide. This really has become not a mental health issue, but a public health issue that we need to address and make improvements on within the primary care practices. So we have a mission to make changes and really encourage not only better screening of suicide, but also intervention on behalf of the primary care providers themselves who have better connections and engagements with their clients than it is to refer or do a warm handoff to somebody new. There is a missed opportunity there that where primary care providers could do some quick, very immediate, short-term interventions that could do something that could have much more improvement than what we're seeing today. When looking at a comparative analysis of what exists thus far for practices and information for primary care providers, there are toolkits such as the one that SAMHSA has created, and the Suicide Prevention Resource Center has another one that really helps focus providers around screening efforts. And again, with companies such as LivingWorks and Connect Suicide Prevention Project, and even with Zero Suicide and the Zero Suicide Institute, they fall short of really taking the screening process and moving beyond that to really encourage and require primary care providers to do something along the lines of a direct intervention themselves. And so that we know that there's a gap that shows within the field of suicide prevention and a gap in the research where we need to make a shift and really require providers to be first point of intervention. And so that brings us really in how we address these problems of practice and the innovative approach that I am here to share with you. And that innovative approach starts with the Suicide Prevention Institute, which would be a not-for-profit organization located in New York City that would have a two-pronged approach to suicide prevention. The first part of that approach is to create a model of care in suicide prevention, and then some training around that model and technical assistance. And then the second part of their approach is to create an accreditation process for agencies that get trained in that model of care to be able to be accredited and to have fidelity to that model. So starting first with the Suicide System of Safety, which is the model of care that we've created, or otherwise known as Suicide SOS. Suicide SOS has 5 different components. And you see here that it really is focused around patient-centered approaches, evidence-based practices, all nested together for, again, the primary care provider to be the one to enact and utilize. Other interventions, both immediate and longer term, are part of the model. And so you see different kinds of techniques such as safety planning interventions or means restriction counseling, or some follow-up interventions such as the use of caring contact or wellness planning. All of that is a part of the interventions that a primary care provider would be trained in and expected to utilize. Additionally, as mentioned before, with the the Institute's accreditation process, we really allow for fidelity of the model of care to exist and to be able to provide ongoing support in that model of care to the people and organizations that are accredited. And ideally, we hope that organizations will get the top level of accreditation and be considered a Suicide Prevention Institute Center of Excellence. Again, this approach is really innovative because it advances suicide prevention and moves it into the field or area of primary care. On the innovation continuum, this is really an upheaval in the way that we are changing the norm for primary care providers, which would be to normally refer to somebody in behavioral health or to not be the ones to do intervention, and instead introduce deviance, this expectation that they would be the one to learn this model of care, build it in as routine practice, and be the first one to intervene on that patient's behalf when they are expressing suicide ideation plans and intent. And ultimately, with that deviant, we want that deviant to become, down the line, that new norm that we expect. The accreditation process is not something that exists with other organizations, and we know that more and more we are being required to improve our suicide prevention efforts. And so this, again, is another innovative opportunity to do just that. As part of our approach in opening the center or the organization and being able to train, we have a pilot approach with 2 phases over the course of 2 years, where we will first train centers, federally qualified centers within the Northeast region of the United States in the model of care, and then follow up those centers in the second year to try to help them to become accredited. And the hope is to have over 78 centers trained in year 1, and 20% of those centers, or about 16, to have been followed up with in the second year and go through accreditation. As part of the pilot approach, we're really also studying and looking at the implementation process on provider comfort levels and overall, hopefully, reduction in suicide attempts and deaths by suicide. And we have created an overview here of our design for training, which really includes in-person, telephonic, and webinar-based learning, with an inclusion, again, of data collection and an organizational self-assessment that an organization would do both pre and post-training to gauge if they have improved in their mind and moved on that continuum of care for suicide prevention. Overall, we feel this is an extremely expandable and scalable opportunity, and want to be able to say that across the United States, the Suicide Prevention Institute trains in the suicide system of safety model of care across the U.S. and who knows, maybe even internationally. We've taken some initial steps to have interviews with key stakeholders, experts, and users of the model of care. We created a prototype of the webinar, which then was given in a 3-hour presentation at a Louisiana Public Health Institute conference in New Orleans in 2018. We developed an activity focused around care and context, and we tested that training activity with a design lab and got some peer feedback. There was an initial phone conversation with Dee Hurst Mental Health Services Suicide Prevention Center in LA to talk about potential possibility of collaborating or joining efforts and helping to run the Suicide Prevention Institute together, as well as a call with the President and CEO of the Council on Quality and Leadership to really understand and improve the infrastructure that we have for our accreditation process. In next steps, we will continue further interviews and collaboration efforts, as well as develop the training curriculum artifact to be shared in more detail about all that entails with that training. And overall, with the innovative approach of the Suicide Prevention Institute and the suicide system safety model of care, we can meet the process of suicide prevention and really mend that process within primary care and ultimately eliminate adolescent suicide. Thank you so much. And All of the references and information are here at the end of the slides that I have shared with you today as part of this presentation. Thank you.